Actually, there are many factors which is related to colon cancer. So the first one, which is really important, is that we have to know that colon cancer occur regardless of age, because the colonic polyp has the direct relevance to the patient's age. So when you're getting older, you have more chance to have colonic polyp. And if you have more chance to have colonic polyp, you have the increased risk of the colon cancer. So at some point, you have to start to be aware of the colon cancer and start to look for the way to check if your colon is clear or not. The second thing is that there are some kind of lifestyle which is related. The reason that maybe the male is a little bit predominant in terms of colon cancer than a female, because of the risk of smoking, alcohol, which is two things, is it had been proved that it increased colonic cancer risk. The other could be related to the metabolism change, like the patient who has the problem with obesity, diabetes, or fatty liver. That's also increased colon cancer about 2 to 4 times above average. So there are many factors which is related. The other factors which is important also is the family history. Even though the patient who has been the diagnosis as the index case of the colon cancer, about 2/3 gonna be the sporadic, it means no family history. But 1/3 could be related to family history. So if you have family history of colon cancer, especially for the first degree relative, you had 2 or 3 times risk of colon cancer. So the first thing is to be prevention of colon cancer. You have to know your own risk first. If you have no risk at all, it's called like average risk. In that case, you have to starting to be cautious about colon cancer as the regular person, which we have the age, specific age to be recommended. Actually, diet has been a little bit of the factors which may be related. Before, we believe that if you eat a lot of red meat, it may increase the colon cancer. If you eat less vegetable or less fiber, it may be also increase the risk of colon cancer. But actually, it's not the major factors. I mean, if you ask me which one is the major factors, I think age is the most important. Actually, the polyp started from some particular area of the mucosal cells which has some kind of genetic disorder. So from normal colonic cells, it will be some genetic trigger, or we call genetic hits, that there are some change of the tissue which make that cells doesn't go for a regular cell cycle. We call programmed cell death. So that cells will not be dead, but it's gonna be last longer than usual. And then it started to make itself like a growth. Okay, so this is one step. So from the simple colonic mucosa cell will change to be the colonic polyp. And from one polyp will change to be cancer. Usually it needs another few hits. So it has to be some also genetic change, some gene abnormal during the growth of the polyp. And then it will change to be the pre-cancer stage that we call dysplasia. And from dysplasia, there are going to be 2 grades of this dysplasia. The first one is going to be low grade, which is like it takes a little bit more time, and then change to be high grade dysplasia. And high grade dysplasia is the status that it's very close to cancer, but still not yet cancer. And for high grade dysplasia, once it's changed to be cancer, then the cancer cell will never die, and then it's going to be keep growing and keep spreading. One of the problems for diagnosis of the colon cancer is that for early stage, like stage 1 or stage 2, most of the patient has no symptoms at all. But when the patient come to the doctor, usually it's because they started to have something wrong, which mostly it's the sign of the growth of the cancer or the tumor, which is big enough to cause some kind of abdominal pain, bowel habit change, like from regular bowel movement turn to be constipation. Or it could be a kind of severe obstruction that make the patient has what we call like alternating bowel movement, like they have few days of constipation following by few days of diarrhea, and then back to constipation again. This is the sign of severe obstruction. Or it could be because of the tumor is too big, and then it causes a kind of ulcer developed and it causes bleeding. So some patient can come to the hospital because of the colonic or rectal bleeding, that you see blood or mucus coming out. Or if it's going to be more severe, the sign of spreading of the cancer, that the patients come with the weight loss or abdominal pain or abdominal distension. But at that stage, it's going to be too late. So if you look for or you wait for the symptoms of the colon cancer that you're going to come to see the doctor, I think sometimes it's too late to get a good chance to get early diagnosis.